Thank you for joining us today. Today marks our first weekly press conference that will occur every Thursday at 10 a.m. During this time, we will provide relevant information to the public about the status of our pandemic response, including the COVID-19 vaccination rollout, and answer any questions you may have. Andrea McClellan, who is in charge of our vaccination rollout, is unable to join us today, so I'd like to introduce Scott Thibodeau, the Health Unit's COVID-19 Public Health Unit Nurse Lead, who will be providing the update on vaccination rollout this morning. Scott is a registered nurse who has worked in public health for 18 years and is currently the COVID-19 Vaccine Public Health Nurse Lead, working with our Director of COVID-19 Immunization Strategy. During this time at the Health Unit, Scott has worked in both the Vaccine Preventable Disease Program and the Communicable Disease Control Program. And during the first wave of the COVID-19 pandemic, he managed the Communicable Disease Program. In addition to Scott, we also have back with us Dr. Carol Zimbalatti, public health physician on our team, and Ms. Shannon Mantha, our Executive Director of Clinical Services and Chief Nursing Officer. Before we jump into providing a COVID-19 update for the region, I want to take a moment to recognize today's National Day of Mourning for Canada's COVID-19 victims. It is also a day to thank all those working to fight the virus across Canada and here in our own community. Over the past year, our community has experienced adversity. It has been difficult for all of us, for our mental health, for our financial well-being, for our social health. We've all made many sacrifices to save lives and protect our most vulnerable. So in memory of the more than 22,335 Canadians that have died from COVID-19, we must stay vigilant and continue to practice public health measures. This is especially important given the variants of concern that pose a heightened risk in our community. So I want to thank the frontline workers who have been helping our community stay safe during the pandemic. This includes our doctors, nurses, our lab technicians. It includes frontline hospital workers, EMS, first responders, and the people working day in and day out to make it easier for all of us to stay home as much as possible, including our delivery drivers and grocery store workers. Thank you from all of us. On Monday, we announced the start of bi-weekly meetings with municipal leaders. Our first meeting will take place next week, Thursday, March 18 at 1 p.m. Our team is very much looking forward to better coordinating and ensuring consistency, particularly as we begin a logistically challenging large-scale vaccination effort across 31 municipalities. Lastly, I'm pleased to announce that we will begin taking bookings for individuals aged 80 plus to receive their vaccinations as of Monday, March 15th. Mr. Thibodeau will provide further details regarding this phase. I'd now like to hand it over to Dr. Zimbalatti to provide a more detailed update on today's case count and COVID-19 data.
Thank you, Dr. Chirico. I'm happy to do that. Over the past week, we have been notified of 2 new cases, bringing our total case count to 269, with 174 in the Nipissing district and 95 in the district of Parry Sound. In total, we have 35 preliminary or confirmed variant of concern cases in Nipissing and Parry Sound districts combined. We currently have 2 active cases, with none isolating in hospital. We also declared that the Castleholm outbreak was over on March 5th. Together, the health unit and Castleholm staff and management worked diligently to manage the outbreak and ensure the safety of Castleholm residents, staff, and essential visitors. That's the local COVID-19 update for today. With that, I'll turn back over to Dr. Chirico.
Thank you for the update, Dr. Zimbalatti, and now I'll turn it over to Shannon Mantha to provide an update on the Lancelot outbreak and any vaccine rollout that she wishes to address.
Sure, thanks, Dr. Chirico. So in regards to the outbreak at Skyline Lancelot Apartments in North Bay, to date, there have been 45 cases linked to the outbreak, with most of these cases being residents that live within the apartment building. As mentioned earlier this week, of those cases, those 45 cases, 21 are confirmed to be the variant of concern that originated from South Africa, or as you may see in the media, B1351. And as of this morning, there is only one active case and there's 0 hospitalizations in relation to the Lancelot outbreak. We are very pleased that the most recent testing done in collaboration with the North Bay Regional Health Centre's COVID-19 Assessment Center that occurred over the weekend as well as on Monday only produced 1 positive result so far. This is encouraging news. The health unit is going to continue to work with the assessment center to assess the need for any additional testing that may occur. Additionally, in response to the ongoing COVID-19 outbreak at Lancelot, and in an effort to help protect or further protect residents, we offered a first dose of COVID-19 vaccination to Lancelot apartment residents yesterday. Our vaccine team set up a clinic on site at the Lancelot building and were able to vaccinate 108 residents. And this is also really good news. So just prior to concluding my update, I'd like to comment on this National Day of Observance, as Dr. Chirico already referenced, specifically to those who have died because of the COVID-19 pandemic. The 3 COVID-related deaths linked with the Lancelot outbreak are really a stark reminder of the reality we are facing and the devastating losses that the community has endured with just 1 outbreak. And as our district cautiously reopens, we can all play our part in maintaining public health measures like physical distancing, wearing face coverings, hand washing, as well as getting the vaccine when it's available to you. So thanks a lot for the opportunity to provide an update today, and we will certainly keep the public apprised of as we learn more about the Lancelot outbreak. And now I'll turn it back to Dr. Chirico.
Thank you very much, Ms. Mantha. Now I'd like to invite Scott Thibodeau to provide the vaccine rollout update.
Thank you, Dr. Chirico, and thanks for the opportunity. To date, we have provided 5,880 vaccinations in our district. We have completed the full vaccination series for all long-term care home residents and First Nations elder care facilities in our district. And as of tomorrow, we will have provided first doses to all retirement home staff, essential caregivers, and residents, as well as all long-term care home staff and essential caregivers. We also wanted to share that in response to the recommendation from the National Advisory Committee on Immunization, the vaccine dose interval between first and second doses is being increased to up to 16 weeks for the 2-dose vaccines currently approved in Canada. So starting March 10th, and with some limited exceptions, citizens will receive their second dose 16 weeks after their first dose. Individuals who have already booked their second dose will have their appointments rescheduled. Current evidence from real-world experience with the Pfizer, BioNTech, and Moderna vaccines indicate high vaccine effectiveness against symptomatic disease, hospitalization, and death from COVID-19 for 2 months after the first dose, including among older adults. Based on immunological principles, vaccine science, and modeling, the short-term protection is not expected to wane rapidly. So the effectiveness of an extended dose interval will be monitored and assessed, including effectiveness against variants of concern. So as Dr. Chirico pointed out, on Monday, March 15th, the ministry's online appointment booking system and our local appointment booking call center will go live. Appointments for seniors 80 years of age and over will be the first appointments available to book. Dedicated clinics across the district for those 80 plus will begin on Monday, March 22nd. So more information to follow regarding specifics regarding that. And with that, I will send it back to Dr. Chirico. Thank you.
Thank you very much, Scott. we're done the remarks, and so we'll head right into the questions. And so if you have questions, please type them in to the Q&A at the top of your screen, and our moderator will read them aloud. And we'll try to cover as many as we can. So Alex, if you could please read the first question.
Thank you. So our first question is from Chris from Day to Day. How are you going to deal with accessibility issues with the elderly at various hub centers, and I'm assuming during vaccinations?
No, that's a very good question. Certainly, we recognize that the elderly have special needs, and we've tried to anticipate many of those needs by looking at the layouts we've pre-selected, and to ensure that there are ramps and people available to help the elderly with that. So yes, that certainly is a concern that we have anticipated as well. Just booking with the elderly can sometimes be a concern. So we encourage sort of family members to help with it. We know that online booking can be a challenge for some, with maybe not even having internet access or being familiar with that type of technology. So we also have phone-in capabilities to book with seniors. So those are many of the things that we certainly understand with the elderly and some of the limitations that there might be. So I'll pass it over to Scott to see if he has any further comments or anything he'd like to add.
Yeah, that summed it up pretty well, Dr. Chirico. And Chris, one of the things that we're doing when we're planning these clinics is we're relying on our municipal partners and our event planning staff and the other municipal partners who have an intimate knowledge of their buildings and their facilities, and we're leaning on them as well, consulting with them to try to eliminate barriers, accessibility barriers, particularly for seniors. So thanks, Chris.
Yeah, and you raised a very good point too, that in planning all of these mass clinics, it's taken everybody's resources, as far as there've been tremendous cooperation from all sectors. And we've been planning this for some time, reached out to many different organizations. And if anybody wants to volunteer, if they wish to do immunizations, we've already reached out, but we welcome everybody's help, because it is a community initiative and something that at the end of all of this, we'll be very proud of taking part with it and to help facilitate. And no job is too small, even if it's simply directing somebody to where they need to go. So we welcome anybody's offer to help out. Thank you.
Thank you. We've had a similar question from a couple of news agencies. And so basically the question is, do we anticipate to move in the color framework tomorrow? And if so, have we provided any recommendations on where we would like to be?
We anticipate that we will stay in the red zone. I think that it goes back to similar responses from previous questions that we've had earlier, and it is that we really aren't an island, and we can't make decisions simply based on what's going on within our boundaries. We certainly know that in past experience that human nature being what it is, people will go from an area to less restricted areas, and we need to avoid that. The VOCs are very serious. It's a game changer, and we have to pay particular attention to them. We know that they're traveling fast. We can see that that's happening currently in Sudbury District. We see it in Simcoe Muskoka as well, and that some of the most recent data is showing that even in a week's time, from the 28th to the 5th, we found that the increase in VOCs went from 19% all the way up to 31%. So we know that they travel fast. We know that at 50 to 70% more easily spread. And so we certainly anticipate remaining where we are, at least for the next week. And that is my recommendation as well. But ultimately, the decision is the government's.
Thank you. Our next question is from Clark from Your TV. He's asking, when will first responders, including volunteers at area volunteer fire departments, receive their COVID-19 vaccine?
I'll defer that one over to Scott.
Thanks, Clark. First responders, firefighters, police officers, as we talked about before, are in a highest priority group, and they're being addressed as we speak to try to figure out the best way and the most optimum method to deliver their vaccine to them. We have engaged community partners as well in this conversation. There will be information shortly regarding this process. Thank you.
Thank you. Our next question is from Jennifer from the Nugget. What are people who have received the vaccination allowed to do? For example, will they count against the number of visitors people are allowed in their homes? Will those who have received vaccination still be required to wear masks or face coverings?
Well, I can start with that one, and if anybody else wants to add in on it. But that's a very good question, and I'm glad you raised it, Jennifer, because it's very important for people to understand a few things with regards to the vaccinations. The vaccinations really don't mean that you can simply forget about all the other public health measures for a number of reasons. One is that with the vaccinations, it takes at least 2 weeks for your immune system to be protected. But it doesn't necessarily mean, and we don't know yet, more studies have to be done, if it means that you could still potentially shed the virus and infect somebody else. It may protect you, but we're not quite sure certainly about that. There are some unknowns that we have to face, that they aren't all 100% effective after the first dose, so there still is risk. We also know that after the first dose, that there may be a period where it could potentially wane, which means that the effectiveness could slowly decrease. So we don't know what the exact time frame is for that. So because these are new vaccines, because not all the information is known, we still have to be very, very careful about what we do. And so we still have to follow the public health measures. It's the best way to protect yourself, to protect your loved ones and everybody else. So you should still only, especially with the variants of concerns that are moving quickly, we need to advise people to stay within their own household and with the members, and not to be inviting other people over or going to other people's homes to visit, to ensure that you are maintaining the 2-meter physical distance. When you do go out for essential reasons only, wear a face covering, wash your hands often, and use hand sanitizers. All those things still apply and really need to continue to apply until we see significant drops in numbers and that we're over this. We're very close. There's hope on the horizon, but we have to be vigilant. I'll turn it over to anybody else if they wish to comment.
I think you've covered it adequately, Dr. Chirico.
Okay.
Thank you. So our next question comes from Eric from CTV. Today marks 1 year since the COVID-19 pandemic was declared. Did you, Dr. Chirico, expect that the pandemic would still be ongoing 1 year later?
Oh, thanks for that, Eric. I was hoping it wouldn't be. I really was. But we did know that historically that pandemics don't come and go that quickly. And so I anticipated that we would still be dealing with it, but I really had no idea to what extent that we would be faced with the challenges that we are. We know that for sure, if you look back in history, that there have been first waves, second waves, and third waves. And some subsequent waves have been more serious than others. We anticipated that would certainly happen. We knew that in 2009, when we had H1N1, that while we had some surges, it ended up that we just have seasonal H1N1. We don't know what's going to happen in this situation. But I think there's been some really, really positive things that have come out of it. This time last year, we didn't even have the concept of a vaccine on the horizon. Now it's been into arms and starting in mid-December. We've come a long way. Yeah, there's still a little ways to go. And the variants of concern certainly are something that we need to address and deal with up front. But thank you for that question.
Thank you. Our next question is from Sarah from the North Star. How many adults over 80 can be vaccinated in a single day? How long is it expected to take to do all who want to be vaccinated within the health unit district?
I'll turn that over to our logistics expert, Scott. I don't have the exact numbers.
Thank you, Dr. Chirico. That's a great question. How many people can be vaccinated is a function of obviously how many clinics we're running concurrently throughout the district, as well as how many healthcare providers can reasonably fit in the venue and the flow of the clinics. But we are throwing everything we have at this, so we can have clinics running in close throughout our district in our hub sites, as well as exploring delivering vaccines in areas within those hubs. However, I think we can get all the vaccines done in a reasonable amount of time, given the resources and the community support, as well as the things that we've done as a health unit in terms of hiring and working with the community. So there's different models that we can use based on the stage that we're in, but we look to be, I don't have the math right in front of me, but I think we can reasonably do this in a time frame that everybody will have a vaccine. Everybody who wants a vaccine will get a vaccine, and I'm really optimistic that we can get this done. Thank you.
I also want to point out too that we also have to take into account the movement and that some individuals, especially seniors, will have some limitation of movement. So it takes a little longer to get through a clinic and get everything looked after. So we have to be patient. And speaking of patience, I also want to point out that for the seniors, as you've raised it, we will be opening the registration for the clinics. And I would like to ask people to be patient. It's going to be a frustrating experience. We'll say that ahead of time, because there is so much demand. The experience of other health units with online bookings, with phone systems, has been very challenging. Oftentimes they'll crash. We'll fix it. We'll get it done. We'll work together, but it may be frustrating, and we recognize that. No system is perfect. Many health units, large and small, have had that experience, but please be patient. We'll get to you. We'll get the vaccine to you as well.
Thank you. Our next question comes in from Chris from Bay Today. What is the local timeline for individuals who have received their COVID-19 vaccines locally to get their second dose? Is it 4 months?
Yeah, thank you. I can start with that question and pass it over to Scott. The decision has been made that after March 10th, the second dose will be up to 16 weeks after that. There's only some limited exceptions, and that would be for those that are very, very high risk. And for instance, the residents, long-term care homes, retirement homes, First Nation elder care, assisted living, and remote and isolated First Nations communities because of the risks and limited healthcare resources. So what they have found is that, and Scott alluded to it in his remarks, is that there is very good protection with one dose. We found that, especially with the Pfizer, Moderna, there is high effectiveness against symptomatic disease, against hospitalization and death after one dose. And I think we have to take it into the context of what we're dealing with, and especially with the variants of concern, especially with the spread that's occurring right now. There is a concern as far as time. So the decision has been made that we've got some very good vaccines that the National Advisory Committee on Immunization has extended to the 16-week period for the second one, in an effort to really get as many people as possible some protection. And I think that's what's important, because this will help prevent people from getting sick, from being hospitalized, from dying, and it'll also help protect the healthcare system from being overwhelmed. So I think that we have to take everything into context. So Scott, if you have anything to add, please.
No, I have nothing to add, thank you.
Thank you. So our next question kind of is along the same lines, and it was submitted anonymously. It reads, should I be nervous about the delay between my first and second dose of the vaccine? Can I still get COVID between these shots?
To answer the question, as far as being nervous about it, I don't think that I would be nervous about it, because you're getting protection. Right now, there's no vaccine as far as you don't have the vaccine, but you will be getting it. And it, as I mentioned just now, it does give you protection. Is it full protection? No, but it's good protection against the disease, against hospitalization, against death. And that, yes, the experts have determined that you can wait up until the 4-month period. So I think that having the vaccine in as many arms as possible is preferential. And that, again, I think we have to put it into the big picture and look at the whole context. And the whole context is, look at what we've accomplished so far with simply having the public health measures that people have done a fantastic job within our district to adhere to, that we've had some of the lowest numbers throughout the pandemic within our district. We were able to limit the widespread of a variant of concern that we had within our district, and we've done that just with the measures. So I think that should help people realize that we can do it, and that the vaccines is an added bonus and to help further protect us. Even if it is one dose, it's effective one dose.
I think it might be important to add as well that by others around you having more opportunity to be vaccinated, so having more people with first doses, that protects everyone as well.
Yeah, that's a good point, Carol. Thank you.
Thank you. Our next questions are from two reporters that are very similar. So basically, the questions are asking, will we have vaccination clinics in some of our smaller rural communities? And do we have the dates of these?
So I'll defer that one to Scott to speak to.
Thank you. We are considering having vaccination clinics in some of our small rural communities. We're working with the hub communities nearest to those communities and looking at the numbers of the high risk, or the populations that we're addressing, and looking at the resources to be able to do so.
I'd also like to add that there are some limitations with the vaccines as far as being able to transport them. We have more options now, but some of the vaccines have to be stored at very low freezing temperatures. And so once they are thawed, you have a limited time frame to get them into people's arms. So we have to work with that constraint as well. And that there is certainly more flexibility with some of the newer ones that we have. But again, the supply of those, we haven't had that confirmed yet. That'll give us more flexibility in what we're able to do. But for now, we have to have, especially with mass immunization clinics, we have to be able to have people come to us. We have ability to provide vaccine to to hospitals, to long-term care homes, all of those that we've done, and their own staff have provided the immunizers to get it done. But for the mass vaccination clinics, which will be held in Sturgeon Falls, North Bay, Mattawa, Parry Sound, and the Sunridge area, people will have to come to us.
Thank you. Our next question is from Chris from Bay Today. How will you cope or deal with people trying to skip the line to get vaccine early? And he says, like, fake IDs, and what is your message to those who want to try to do this?
Yeah, that's always an issue, and it's very unfortunate. And you know, we certainly, the vast majority of people are very honest, and in fact, many people will put other people in front of themselves to get the vaccines, feeling that they need it more. And I think that that's what we really need to emphasize, and that's important. I would ask that it's very challenging for us to be able to verify all of the different groups and categories, and sometimes it's impossible. When people say, well, I have a heart condition, or I have cancer, or I'm on chemo, we have to take people's word for it. Family docs can help provide a list, but ultimately people need to certainly think about what they're doing, and realizing that we're all in this together. We all need to try to help one another and be COVID kind, and think about other people, and I trust that people are going to be honest. And for those that feel that they want to do something otherwise, I hope that they won't.
Thank you. Our next question comes from Jennifer from the Nugget. How many vaccine doses have we received to date? And when are we expected to get our next shipment? Are you still confident all residents who want the vaccine will get their first dose by June 30th?
So I'll turn that over to Scott.
Thank you, Jennifer. We are now receiving regular doses, and we expect to get regular supplies from the Ministry of Health on a weekly basis. And as long as that continues, we are still shooting for that date, and we are hopeful and confident that we can meet that. But it does depend. It does depend on supply, and there are variables there, right? So we're trying to anticipate. We're trying to anticipate and plan accordingly, given the commitments that were made to us in terms of our vaccine supply, and we're moving ahead with that.
So our next question is from Dean from KFM Radio. How much discussion does the health unit have with city councillors and different mayors in decision making when it comes to moving around the color framework? Does any opinion outside the medical field bear any weight?
Well, thank you for that question, and it's important. And I think it underlines what our different roles are. And I certainly respect the roles of municipal leaders and councils. They have a job to do. They represent their constituents, and their job really too is to foster rigorous debate. However, my job is to make decisions based on public health. It's to make decisions that pertain to the health and safety of our communities. The system is set up so that it is a recommendation of the medical officer of health, and through legislation that we have certain powers that have been given to us, so that we can make decisions that there's no influence, there's no or interference from other sources, so that it's based solely on public health. Is all that other information considered and important? Absolutely it is, and we welcome it. We have, from the beginning of the pandemic, we've reached out to many community partners, institutions, organizations, worked with them, and gathered information. But ultimately, the decision for the recommendation comes from the medical officer of health. So what I do is, the process that we follow is that I look at what the problems are, what issues that we have facing us. I then look at getting as much information from many different sources as I can that will address those problems. We then look at certainly what options do we have available to us? What makes most sense? And then we look at the risks. We look at the benefits of it. And then we come to a conclusion, and I consult with certainly our executive team. We have experts, not only within our health unit, we have Public Health Ontario experts that we avail to. We speak to the Chief Medical Officer of Health, the government, municipal. We get feedback. We've had meetings with municipal CEMCs since the beginning of the pandemic. So we do get lots of information from lots of different sources, but ultimately it is the decision of the government as to what framework level we are put in, and I can only make recommendations based on that. And the recommendations that, as I've mentioned before, the two biggest factors are the variants of concern and what's happening in the regions around us. Those are the two primary factors that we have to consider. So I know that people have suffered. I know that it has taken its toll on people's mental health, their economic health. I know addictions and overdoses have increased. I recognize certainly that there has been domestic abuse, but we're also facing, on the other side of it too, very serious consequences that will occur if this gets out of control, and if the variants get out of control, can overwhelm our healthcare system. More and more people can die. So all of those factors are taken into consideration.
Thank you. Our next question is from Eric Thompson. Now that we're out of lockdown or shutdown, some business owners are curious when and how often they'll be updated on where we are in the provincial COVID-19 framework. Will there be weekly updates as whether or not we're going to move out of red?
Yeah, it's a very good question, and I understand that it's very difficult for business owners. Certainly, the last thing you want to do is to be stopping and starting and closing and opening, and that's something that certainly everybody wants to try to avoid. But I want to say first too, though, that globally what we've learned is that the best way to have long-term reopening is not to open too early. We've seen that happen, and it's not an advantage to anybody. So that what we will be doing is that there's a number of things in place. We are having these media conferences certainly every week. We'll be meeting with the municipalities every 2 weeks, and if there are updates to be had. The other thing I think is important for you to note as well is that we're constantly, every day, looking at the situation, not only within our health unit district and boundaries, but what's going on around us and throughout the province and even nationally, internationally. We're monitoring that. We keep a close eye on that. And that informs our decisions. And we can, and we have the connections, certainly personal communications with directly to the Chief Medical Officer of Health. If there is an urgent or emergent situation that arises, that we can speak to them, as well as government officials. I've worked very closely with Mr. Fideli. He has been a great resource and has very much advocated, as well as I have, to get more vaccine. All those things come into play. So if we need, and we also have to realize that things change quickly with this variant. It moves fast and it can change overnight. So we have to be flexible. And as much as we'd like to give you as much advance warning as possible, right now we're in a very tenuous situation of being, we have to maintain the same kind of public health measures, and they have to be adhered to. Otherwise, if they aren't, numbers will increase, and we'll again have to have more further restrictions. Nobody wants that.
Thank you. Our next question is kind of on a similar line. So Eric from CTV says, Sudbury just announced that they are moving into the emergency lockdown starting tomorrow. Dr. Chirico has said that we are not an island. Does this raise concerns for our district considering how close we are to Sudbury, and could that force a decision to move into a tighter restriction?
Thanks for that question, and absolutely, that is a possibility. And that is why we really are pleading with the residents within our own district to continue to follow the public health measures, to continue to stay at home and go out only for essential reasons, and maintain that 2 meters, wear face coverings. So what's happening in Sudbury is absolutely very important. And the same thing does not happen here, and it can get out of control very quickly. And yes, there is, if we see our numbers going up, that may be our only option, is to do the same. So we're asking people, do not travel out of our district. We and to stay within our boundaries, and to use your really good judgment, which you've done throughout the whole pandemic. And that's been able to keep our numbers very low, to be able to keep us from having widespread VOC outbreaks. We've done that. You've proven that you can do it, and we just need to hang on a little longer, because if it does get out of hand, yeah, Eric, we may have to go to the lockdown.
Thank you. Our next question is from Jennifer from the Nugget. When will those 80 plus start to get vaccinated? I understand appointments can be made as of Monday, but when will the actual places such as Memorial Gardens open for the vaccinations?
Yeah, I'll pass that to Scott. We have all those details worked out.
Thanks, Jennifer. The immunization clinics for 80 plus will start the week of March 22nd throughout our region, utilizing the hubs that we previously spoke of. The details, the exact times, and the dates and hours of the clinic will follow, and they will be posted on our website, as well as communicated widely. So stay tuned for that. So you're right, Jennifer, as of Monday morning at 9 a.m., the ministry portal is opened. The scheduling portal will be populated with the clinics that we finalize in the days to come. You'll be able to book it online, as well as facilitated by our call center, the online booking as well. So we're looking forward to that.
Thank you. Our next question is from Eric Thompson. I might have missed this earlier. How many hours a day / days of a week will the mass vaccination clinics be operating?
Scott?
We're looking at operating 8-hour clinics in certain days, 4-hour clinics in certain days, depending on the municipality, depending on the area, and depending on the preferences that the individual factors that we encounter. But large 8 to 10 to 12-hour clinics are on the table. We're just finalizing those details as we speak. We want to be able to get as many immunizations in arms as possible in a reasonably short period of time, and also recognizing the preferences of certain age groups in terms of time frames, as well as considering, some of our 80 plus people obviously will be accompanied to clinics. So we're trying to allow for after hours clinics, after daytime hour clinics, so they can be accompanied to the clinic. So we're trying to consider all those factors as we move forward.
And we will be working through weekends as well. But I know that there's been a call, especially down south, people are raising, well, how come you're not running them 24 hours a day? We simply don't have the capacity. We're going to be having to do this for months and months and months to get this done. So we just don't have the capability to do that 24/7.
Thank you. So we just have time for our last 2 questions that have been submitted. So the first is from Dean from KFM Radio. if we drop to 0 current cases, so I'm assuming active cases, wouldn't it be strange to still be in the red zone, even taking the surrounding areas into concern or consideration? Will taking other communities into thought always be a factor now? And then following that, he says, is there really that much of a difference moving to orange?
I'll start with that question. I do think that there's currently, if we were to look at our numbers and based on the indices that they use in the framework, we would be in green. And I think that's the absolute wrong thing to be doing right now for the reasons that I've already mentioned. So I think that the factors with the variants of concern, the way it travels, how much easier it is to acquire the infection, that all those are very, very important, and they override the low case numbers as far as weighting in the decision. So that, coupled with what's going on around us and throughout the province, those are the main factors of why we need to stay where we are.
Thank you. And our last question was submitted anonymously. Thunder Bay is seeing a rapid rise in cases and schools are closing again. What has caused that, and how will our district protect against that?
Well, thank you for that question, and it's important. We've been working very, very closely, certainly with the school boards. We have nurses that are dedicated to that. We have a school team, and we've worked with them from the beginning. The schools and the school boards, the teachers, the staff, they've been phenomenal in putting in measures in place that certainly will help protect the students. We also felt that back when they were deciding to go into shutdown, should schools remain open in the north? They were going to be closed in the south, but should they remain open in the north? We had low case numbers. However, I recommended that we keep the schools open because we had the measures in place, because we felt that it was essential for the mental health, physical health, social health of students that we could do that. As well, I also stated back then that what we would do is we'd monitor it very closely, and we do monitor it very closely. And we look at, are there any cases? Is there transmission within the schools? We look at potential for outbreaks. And so by doing that, we kept an eye on things. And I also said that we would act decisively if things changed. When we had the VOC outbreak at Lancelot, we were able to quickly identify students in 2 different schools, and we're able to act quickly to prevent a widespread outbreak by closing them down. And then they were safely able to reopen. So measures are in place. Does it mean that we won't be closing schools? No, we have to monitor it daily and see, because it does change quickly. And if we need to close schools, we will. To protect the students. And there's enhanced screening that's going on as well, and testing. So all of that combined, we feel that the benefits of having school open at this time certainly far outweigh the risks, but we certainly keep a close eye on it.
Thank you. So that concludes our press conference for today. A recording of the press conference will be available on our website this afternoon, and check back in next Thursday at 10 a.m. for our weekly press conferences. Thank you.